Good morning, everyone. It is great to see your faces or your squares on the screen. It's an honor and privilege to welcome you, each one of you, to our 2026 Culture of Data Conference that is brought to us by the Colorado Public Health Association. My name is Ann Hill, and I am one of the co-chairs, and I am joined here with my other co-chair, Ben Lashuk. And we are so grateful that we're able to host this year and still do it virtually too. We also have CPHA's Madison Wagner here, and then our Culture of Data Committee members, whose work is truly instrumental in getting us here today. I personally want to thank all of the volunteers for everything that they do. This conference continues to evolve, and in my opinion, it is certainly due to the work that our volunteers provide. So I could not be more grateful, of course, for all of the volunteers that we have. I also want to extend our heartfelt thanks and appreciation to all of our sponsors who keep the Culture of Data Conference moving and going. And it helps us, we're able to host it because of these sponsors. And you will hear from them throughout the conference. To everyone in attendance, from all of us here at the Culture of Data, we thank you for helping us kick off what we hope to be a truly inspiring set of discussions from all around Colorado. For the time being, all of you will be muted. There will be time near the end of this particular session for question and answers, where we encourage you to unmute yourself, and or if you don't feel comfortable doing that, you can go ahead and put it in the chat, and we will be monitoring the chat too. At this point in time, if you feel comfortable as well, please add your pronouns to your Zoom name, and then you can actually do so by clicking the three dots on your name and on your video square, and then selecting rename. This year's conference theme is the People's Data, Democratizing Access, Understanding, and Use. Our committee and our leadership at CPHA have put together what we think is a very inspiring and impactful set of speakers that will remind us why we do what we do in public health, but also in data collection, analysis, and interpretation. It's our hope that as the conference moves forward, you'll feel inspired, replenished, and engaged, and ready to tap into the programs, projects, and people that keep us on the right path, the path of health equity and justice. I'm now going to pass the mic over to our current CPHA president, Jason Wright. Jason?
Thank you so much, Anne, and good morning, everyone. My name is Jason Wright, he, him pronouns. And as Anne said, I'm the current board president of the Colorado Public Health Association. So on behalf of CPHA, it's my pleasure to welcome all of you to this year's Culture of Data Conference. Very grateful to see such a strong, diverse group of public health professionals, community leaders, and data experts, as well as our partners. Always a pleasure to have our partners here joining us today. So as Anne said, this year's theme, the People's Data, Democratizing Access, Understanding, and Use, really does speak to something fundamental in all of our work. So like you, I know that data is not just numbers on a page or points on a dashboard, but at its core, data represents people, communities, and lived experiences. And so when we improve how data is shared, accessed, analyzed, and understood, we not only make it more meaningful and useful to those communities it represents, but we also strengthen our own ability to serve them more equitably and with a lot more respect and impact. So if you've attended the Culture of Data Conference before, you know it has always been about more than just technical skill building, right? It's about shifting how we think about data. It's about learning from real world examples, and it's about collaboration across sectors, building data partnerships and developing the capacity to advance health equity. So throughout the conference, you'll explore approaches to data storytelling, visualization that help build trust, counter misinformation, and you'll engage with ideas that center community voices, ensuring that data is co-created, interpreted, and used alongside the people it is meant to serve. So, as the current and very new director of the Evaluation, Innovation, and Research Department at the Center for Improving Value in Healthcare, I don't have to assure you, but I can assure you this work is it truly matters. So when communities have these tools and the knowledge to understand and use data, they really are best positioned to advocate for themselves and to drive the solutions that reduce those disparities. And that's truly how we move closer to our shared vision of creating the healthiest Colorado for everyone, in my opinion. Um, I would like to extend my sincere thanks to all of you for being here and for the work that you do every day to improve the public health across our state. I also want to recognize and thank our sponsors whose support makes this conference possible and helps sustain this very important work. And then a very special thank you to our Culture of Data Conference co-chairs, Ann and Ben, you're amazing, as well as the entire Culture of Data Conference Planning Committee. All of your work, dedication, time, and thoughtful planning have brought this event together once again this year, and we are truly grateful for your leadership and your effort. So as we begin today's sessions, I encourage all of you to stay curious, ask questions, and connect with one another because the ideas and relationships built here at this conference really do have the potential to shape how data is used across Colorado, not just in the short term, but for years to come. So thank you again for joining us. I hope you find this conference as engaging, inspiring, and valuable as I always do. And to end, I hope you all have a wonderful day. It's nice to see some very familiar faces from previous positions. And so I'm just glad that we have such a great turnout. So I'll pass it back to Ann and Ben.
Thank you so much, Jason, for those kind words. I now have the pleasure of introducing our Culture of Data keynote sponsor, which is Colorado Access. We would like to introduce Joy Tosagi. I hope I said that correctly. Joy, if you're here, would you like to say a few words?
Absolutely. Thank you so much. Public health data belongs to the public. And because the decisions it informs shapes real lives, whether a child gets vaccination on time, whether a pregnant person finds the right support, whether a family keeps coverage when life changes, data can be a flashlight. It can show us where barriers are, where systems are working, and where people are being left behind. But too often, the people who need that flashlight the most can't access it. The information is hard to find, it's hard to interpret, or disconnected from the moment decisions have to be made. And the people's data is a commitment to do better, to treat data as a public good, clear, usable, and built around the questions communities are already asking. So information becomes a bridge to action, not another barrier. That's why Colorado Access is here. As a local community-based nonprofit health plan, we live in the space where public health meets the exam room and the kitchen table. We see how policy and system design show up in daily life. And we believe that when communities have information that they can trust and use, they can move faster, advocate more effectively, and stay connected to the care and resources they deserve. In our Latinx immunization efforts, we partnered with trusted messengers and community organizations to better understand barriers, tailor outreach, and focus support without reducing communities to statistics. We use these same principles through Public Health Emergency Unwind, where we were out in the community alongside partners sharing practical guidance about renewals and redeterminations, helping people make sense of notices and learning in real time what families need to keep coverage. That work matters even more as we look ahead to continued eligibility changes, operational shifts, and major policy changes anticipated under HR1 that will make it difficult to maintain stable coverage. As a result, I would like to share with you that we have a commercial option coming onto the marketplace starting in 2027, Colorado Access Choice. And these plans are being designed to support individuals and families who may move in between Health First Colorado, Colorado's Medicaid program, Child Health Plan Plus, and the individual marketplace. Our goal is to reduce those disruptions by offering a trusted local option that supports continuity of care and connection to community resources. Importantly, we also aim to reach Coloradans who are currently uninsured by offering the strength of our provider networks and our long-standing partnerships with local communities. Finally, we want to be clear about how we define success. It's not clicks, traffic, or downloads. It's whether people can make better decisions and whether systems become easier to navigate. And we look for outcomes like fewer coverage losses for administrative reasons, faster connection to primary care, more completed renewals, and fewer dead ends when people try to find help. So as we gather at this conference, our invitation is simple. Let's build data that people can actually carry into clinics, community organizations, policy meetings, and everyday conversations. Let's open standards to reduce friction because when data is built with people and returned to the public, it becomes power. And that power can drive faster, fairer action. Thank you.
Thank you so much, Joy. Those were inspiring words. Thanks. I do want to acknowledge that we would not be able to deliver, obviously, this wonderful programming without the support of sponsors like Colorado Access. You certainly, for everything that you've done for the Culture of Data Conference for this year and for data equity in the state of Colorado. Thank you for your efforts. We now are at the meat of our opening panel. I'm now going to pass the baton over to our moderator for today's panel, which is Dr. Spiro Manson, who is a distinguished professor and director at the Center for American Indian and Alaska Native Health, also known as CAIAN, which is at the Colorado School of Public Health. Dr. Manson, the floor is yours.
Thank you, Anne. Thank you, Jason, as well as Joy, for those opening remarks that really set the tone for our conversation today. And we do intend to have this as a conversation engaging each of you in this shared agenda and the values that we each bring to it in our particular ways. In working with American Indian Alaska Native communities, I'm an enrolled member of the Little Shell Chippewa from the Turtle Mountain Reservation in North Dakota. We have two particular things that capsulate this particular topic. The first is nothing about us without us. And secondly, we know that in fact, it only takes 3 minutes to unravel 30 years of trust building in our partnerships in seeking to move forward in all aspects of the acquisition of data, the discoveries that follow, the interpretation, and most importantly, the translation of those findings to the benefit of our constituents and the communities of whom we are part and we serve. We're privileged today to have three extremely distinguished panelists who will be sharing their particular stories with us in this context. And I'll ask that each of them introduce themselves in turn. And ultimately, we want to leave time for our conversation to include. Undoubtedly, there will be questions and comments that will arise just for the sake of the seamlessness of the presentations and our opportunity to engage. We ask that you hold those questions, put them in the chat box, which we'll monitor, and then we'll return before the close of the hour, hopefully about 10 to 15 minutes, to be able to address those questions and to engage one another. So if we can begin first with Andrea, if you would introduce yourself and set the stage with respect to your experiences.
Hi, everyone. Thank you so much for having me. My name is Andrea Giron Mathern, and I hold a PhD in research and evaluation methods. And I really specialized in how we can look at research and evaluation from a more holistic perspective, in that we have such a great prompt here. It was like, what does people's data mean to you? And I can't remember if we reviewed that when we came together as a panel, but I was like, oh my gosh, this really has me thinking, because I'm like, whose data is it if it isn't the people's data? I think particularly now where we're sort of changed into numbers and there's a lot of push to gather big data and learn a lot of information about us, being able to use whatever information that is there for us to make really great decisions or really informed decisions about ourselves, our personal circumstances, our familial circumstances, our neighborhood and community circumstances. It's so essential. And in all the work that I've done, from national to, in my backyard, starting locally, starting as small as we can to create change is really important. So having access to information and understanding how to use it, so making it accessible, and understanding what we're collecting, I think is really important, and that has driven my entire career. So I'm super excited about this discussion.
Thank you. Enrique.
Good morning, everyone. Thank you for having me here. My name is Enrique Arturo Orozco Perez. I am the co-executive director of Compañeros, the Four Corners Immigrant Resource Center here in Durango, Colorado. Our organization, we work across Southwest Colorado and also parts of northern New Mexico by supporting immigrant families through legal services, resource navigation, education, community engagement, and sadly now rapid response against ICE. And yes, as Andrea alluded to, the question for us, so what does the people's data mean to us? And when I think about that, I think about, ownership and not extraction. For immigrant communities, especially in rural places like Southwest Colorado, data has historically been something that researchers come to collect, publish a report about, and then they leave our communities. The community rarely sees the benefits of that information and that research. So for us, for me, people's data means lived experience, community knowledge, and collective memory. It includes what families share about barriers to healthcare, housing instability, immigration enforcement, and the daily decisions people make to survive and support their families. In rural communities where official data sets often overlook immigrant populations, community-generated knowledge becomes essential. It helps us understand what actually is happening on the ground, and ensures that people's story of our communities are not erased from policy conversations. So for us, the people's data actually means it being the people's data.
Thank you very much, Enrique. Casey.
Hi, everyone. My name is Casey Neese. I use they and she pronouns, and I'm the Impact and Communications Director for Provecho Collective. And we're a collective impact organization covering us statewide convenings for food system activism across the state. And so we build a movement for responsive and equitable and sustainable food systems by shifting powers to local communities. And we have a lot of people's data kind of happening within Provecho. I'll talk more about our committee spaces later, but I think a big part of what I really hammer down in when talking about democratic data is that every data point represents a human, especially when they are data collected from humans, right? And so even when you're looking at aggregated numbers, understanding that the sum of those aggregated numbers represents an individual and their experiences, their identity, the challenges, barriers, and desires that they bring to the table. And I think people's data always is about access, and just making sure that when we're collecting data, there's talk about consent to collect, consent to share, consent to reaccess, and consent to delete when data doesn't become safe again. As Enrique was saying, like, we are facing some really terrible and frightening times for our communities. And we've had to make some hard decisions about removing data that is no longer safe. And it's a scary thing to be in a place when you are a data expert, deleting or removing data. And And sometimes that's the right move because that has been what has been asked for by community.
Thank you, Casey. Well, I think the audience can immediately discern the common thread among both Andrea's and Enrique's and Casey's positions and organizations in their commitment to this particular set of issues. Let's move a little more deeply now into the subject at hand. Specifically, there's a great deal of clamoring, and we've heard it echoed here, about the need not simply to impose or to drive the research and the evaluation efforts, reflecting the investigators or the organization's own agendas and priorities, but to align those with the communities of interest and to whom these efforts are intended to best serve. But how do we do that? How have, in your particular experiences, have you begun in concrete ways? And Casey, I think you anticipated a couple of examples of how we align um, the nature of the questions to be asked, the manner in which information will be gathered, the way in which those data will be managed, curated, and ultimately examined and interpreted, and most importantly, as each of you emphasized, the application of the resultant findings for the benefit of our respective constituents. Could you provide each of you a little bit of an example of how you've moved forward into this arena of co-designing and co-implementing such efforts? Let's move backwards. Casey, would you start us off, please?
Yeah, the first thing that comes to mind with this question is actually that there aren't shared priorities among communities all the time. They're not monoliths. And so a lot of times when you're talking about how do you ensure that the data represents the community's desires and needs, some of that work is just helping um, have that dialogue about what are our desires and needs. And you'll find that there's a lot of variance there. And within communities, within really tight knit communities, even there's some work to be done to help and open pathways for communities to align around certain desires for data collection. One way we do this is with Provecho is we have a data committee. We meet monthly. We actually just met yesterday, and it's always a lively conversation. And this space is really unique in that it's not data experts. There's a wide range of folks from someone who has attended a food pantry to our food pantry staff, state level evaluation experts, people working in data in the SNAP and WIC offices. It kind of ranges the gambit. And so in that space, there's an opportunity to elevate what questions have come up. And in a specific example I'm thinking of, there's a lot of curiosity around what data is collected at food pantries about the clients. And so it engages conversations from everyone from a funder who's like demanding certain amounts of data to that community member who is asking, why do you need to know about my race? Why do you need to know about my immigration status? And it opens conversations to shift some of those data collection tools. And hosting spaces like that is always wonderful for me when I'm actually doing an analysis. I want to bring it back to that community, be like, did I get it right? Like, what am I missing? And oftentimes it results in shifting the way we're scripting our insights, the way we're actually writing about it and presenting it back before that large scale launch and publication. That's just, I'll stop there.
That's wonderful. Thank you. Enrique, your views on this?
Yeah, if I'm understanding the question right, for us it's really important when we're taking this data and we're using it to create change and community action that again, as Casey mentioned earlier, that we're continually checking in with our community members and making sure they're actually the holders of that data. We are like their library where we can contain it, and we also make sure that they are very transparent. We're very transparent in knowing what we're collecting from them. We also try to implement that with doing a tiered consent model where we actually give them the option to be like, hey, this is what we want collected. This isn't what we want collected. And we don't just use the tiered consent model because we also kind of mix in their regular check-ins to make sure that whatever they put into that is still aligned with what they want shared. And to give you an example of that, so obviously I work in immigration advocacy right now. ICE is a big topic and immigration enforcement. We don't have much data collected in this area about the detentions happening except for within our own organization. And we've had to be very careful in how we collect that data and how we use it. It's very clear no one wants any information about their gender or anything that could put who they are in that data. So we don't collect that. We make it very vague, and that's to protect our community members. But that data has been powerful because the community members have allowed us to use it in a way that aligns with their safety and also creates impact so much that when we put out our executive summary on what is happening in our area, we were able to get decision makers like Senator Michael Bennet, who came in a non-campaign role behind closed doors to meet with our community members, because that data that the community allowed us to use created enough buzz in our area to put a spotlight in this area for what is happening with immigration enforcement and how it's affecting every aspect of our daily lives here. So anyways, I went off on a tangent. All to say is for us, the big thing is that consent model and doing regular check-ins in order to make sure that data is still being used in a way that our community that is aligned with our community. Otherwise, as Casey said, we don't use it. And again, we'll have to go and delete it. I'm part of right now a Rikers Memorial Project, and that's one of the things we're experiencing right now is folks who have left Rikers who at the time wanted their story told, and now they don't. And yes, that's a punch in the gut for us, but we have to respect what they said. So I hope I answered the question, but that's kind of where my head went.
Well, you were spot on in your answer, Enrique, in providing concrete examples of that. Andre.
I love everything that Casey and Enrique said, and so I'll try to add just some additional tangible things that we've done. So oftentimes, especially when we have the ability to collect a lot of information, we want to take shortcuts because as the people who are going to analyze the data are like, oh, it's much easier for me to have a checkbox than to have an open inquiry, to have somebody write something in. But allowing people to write things in can offer a lot more autonomy and power for them to talk about what they want to. And we actually learn a lot of information. And so I've worked with organizations where we push to do that around race, ethnicity, where we push to do that around gender identity, so that we're not forcing people into a category that may not reflect who they are. And so that we can also learn a lot more about how people about language and the evolution of language and the evolution of identity. So that's another suggestion, or just example, not a suggestion. Do it, don't do it, doesn't matter to me. But the other thing has been really coming in and asking why. Why do we need this information? So Casey's example of like, why do you need my race when I came in for a box of cereal? I came in for bread. Why do you need to know that? And that is my favorite question. I think as a researcher and evaluator, I'm not alone. And so asking why, asking an organization, asking yourself, why do we need this information? Are we planning on making actionable steps with this particular, inquiry instrument on every single question? Not, well, we might need that in the future, like that. Then come up with a different tool. Come up with a different tool when you know you need that information. And on that part, I've been doing a lot of work with funding organizations, with philanthropic organizations, because I have the same question. I have the same question. Why do you need that information? How does that help you make decisions about the impact of your dollars? Because oftentimes organizations are asking questions because their funders want that information. And so really working at all levels to really examine why we're gathering information. We're getting even more data crazed as a culture. And so just thinking like if we have more information, we gather more information, we can, that's better. And it simply isn't. Not all information, not all data is good data.
Oh, that's a wonderful observation. Thank you. So just earlier in the week, One of my constituents posed this question to me. Spiro, you used the phrase the community. Well, how do you know who the community is? What are the defining features? Who are members of it? Who's appropriate to represent the views of the community? Aren't I, as a investigator, aren't I, as a sponsor, aren't the constituents with whom I work all constitute community? So, Andrea, can we work backwards from you? And how do you think about identifying, quote unquote, the community and how it's comprised and your access and working with those representatives?
Oh my gosh, I couldn't unmute fast enough. What a great question. I think Casey also primed us for this. I mean, my reaction to the community is just it's another way of othering ourselves, like I have the same question. I'm like, who is the community? Are you not the community? A community as a staff, as yeah, as researchers and evaluators. Like when we talk about that, I feel like it's just some kind of way that we have evolved our language into a kinder way of othering people. And so I'm really cautious about using that language at all when I'm doing evaluation and research work. And if that is language that's coming up, really investigating what we mean by it and where we really are trying to put that umbrella over groups of people and what defines sort of in and out, in group, out group identifiers so that we know that. And again, being cautious about the word community, because I belong to so many communities as one person. And so if people are like, I want information about the community, that may or may not be an in-group identity for myself in that moment. And so I think it's really just investigating our own, just like we ask why about every question, asking why about how we're grouping and qualifying people. And I'm oftentimes reminding organizations that I work with that you are a community. As a staff, you are a community. As a field, if you identify with a field of practice, a professional field, that is a community. And so being really cautious of the way that we utilize the word, the phrase, the community, that actually is just like othering and grouping us separate from a group of people we want to study. I don't know if that was helpful, but that's what I wanted to say.
Oh, well, I think you accomplished both, wanting to say what you wish to say as well as being helpful. Enrique, your views on them.
So I'm going to stick with community because I like that conversation on like how do we define that? And yeah, it's hard to define it. I think because Compañeros works in a very specific field, which is working with the immigrant community. We do kind of other them by calling them the immigrant community. I prefer to call them members of the organization because they are our members. So when people come to us, I make sure that, when they're like, hey, so what's the perspective of the immigrant community? And I will then say, our members think so and so and so, if I have that answer, because I don't speak for our members either. So it's very interesting, and I think when it comes to language too, not just when it comes to differentiating what is community, what is not, I think it's just in anything when it comes to data and research on how we label people, we have to be very careful with language. So I love that point. And finally, I would say when it comes to community, especially in this like rural area, we do need community to get our work done. Compañeros is the only immigrant servant organization across the Southwest. So without the actual Southwest community and then the Montezuma community, the Archuleta community, the La Plata community, if we don't all join in as one network across the Southwest, it's very hard to do this work. So community here does involve a lot of people that aren't always members of compañeros, who aren't part of the data set we're grabbing from. So it's very hard to discern exactly what community is. So I like to say the Southwest community, and then the folks who use our services are our members because they make up our organization.
Thank you. Casey.
I don't know if I have a ton more to add. What I can add, maybe is offer a tool that I've really liked. There's oftentimes when we're engaging very diverse collaborators, I like to use a power map to really understand who is at the table, right? And so a power map, you have an X and Y axis. Like your Y axis is amount of power someone holds, the Y is the amount of interest. So some communities may and some individual collaborators may hold really high power in property ownership or in like funding or anything like that. And then it may look similar or may look really different for the folks who have really high interest or even are like the most affected by the situation at hand. So really defining your research questions, defining your goals, your objectives helps identify like who is at the table, the different levels and types of power that folks are bringing. And then you're going to also throw out that power map at some point when you realize that high power and resources aren't always defined the same way, but really kind of mapping your community in a way to demonstrate diversity within, I think helps understand these complexities that Andrea and Enrique are bringing up.
Thank you. I want to underscore the fact of the diversity within community, however we may define it. I think, as Andrea pointed out earlier, that the assumption that it is a monolithic entity is a false one that leads us in directions that may not necessarily be productive. So let me shift gears a little bit. Enrique, you particularly, but Casey and Andrea, you've also introduced the importance of the current political landscape for of the backdrop behind what we can acquire, how we should acquire, what it should be done with the nature of data. But there's also a major movement afoot with respect to the science surrounding this. And artificial intelligence and machine learning are being, as we all know, promoted heavily. They're promoted heavily as ways in which to quote unquote objectify the nature of the data, to remove the human factor in terms of its interpretation, to address matters of fairness and equity. But I think our experience, as well as the emerging literature, suggests that those are not the cases. So, how are you thinking about the ways in which we should approach, contextualize, and, if appropriate, pursue the use of artificial intelligence and machine learning as tools for the nature of our work? Enrique, can you begin?
Yes, I love this question, and so yeah, I'm just going to go into it. So, from my perspective and the perspective of the organization, we approach AI with a great deal of caution and skepticism. Why? Right now, these tools are being deployed way faster than regulations and oversight and than oversight is having to protect communities. And honestly, rural regions are already seeing this impact of these technologies, and they typically have the least voice in the decisions being made. We can see this already in Greeley. Community members, for example, there are talking about growing concerns about large data center developments that are being built to support AI infrastructure. And these projects place enormous demands on local water, electricity, land resources, and rural communities are often expected to absorb those impacts without meaningful consultation. Again, look into the case in Greeley. But from the immigrant community's perspective and the Latinx communities, the risks go a little bit further. Many AI systems are trained on incomplete or biased databases that do not accurately reflect rural or immigrant experiences. So when those systems are used to interpret health data or community data, they can reproduce the same inequities we are trying to address. Because of these concerns, we're not really relying on AI as a tool right now for interpreting community data. Instead, we prioritize peer-to-peer research, human review. The information we collect is reviewed by trusted colleagues, community leaders, and partner organizations who understand the local context before anything is published or shared publicly. This approach is slow, way slower than an automated system, but ensures that the interpretation of the data reflects the lived experience rather than the assumption of an algorithm. So public trust, and we know right now public trust is also very fragile when it comes to data, especially in rural areas. So we're trying to build that back through our organization. A lot of data doesn't apply to our rural area, and we have a lot of trouble finding this stuff. So we are prioritizing when it comes to our local data, trusted community messengers, and culturally relevant communication to make sure the data we are producing is accurate. And then if there are numbers, that will drive our narrative of the data we are producing too. So yeah, I'm very cautious of AI. Sorry if there are people who are very interested in it. Glad Palantir's out of Colorado, and I hope Greeley wins their fight against the data center. So sorry.
Well, thank you, Enrique. I don't think any apologies are necessary. I think those of us who are deeply committed to this particular set of issues recognize that minimally we need to be critically informed about the strengths and weaknesses, the advantages and disadvantages of the various tools that we use. Andrea, I wonder about your perspective on artificial intelligence and machine learning.
Yeah, thank you. I agree. No apologies necessary, Enrique. Your perspective and voice and passion are always part of why I have loved being on this panel with you and a former one. I completely agree. We do know that they're biased. We do know, and they're moving so quickly. It's moving so quickly. And so staying informed and engaged of how to use them in a responsible way is actually like a part-time job. And so I think it's really overwhelming. It seems like in many ways it is a simple or an accessible solution. I think one of the things that we talked about when this popped up in a prep session was another element of the work that we're all facing, which is some of us are in very small organizations and don't have the human power to even do effective, empirical, people, human-centered evaluation and research. Like that takes a lot of time and energy. It really does. And so trying to hold in my reality that for some people, this offers a solution when they have nothing. And so I think, like you said, I think the more that people in the research and evaluation field, and those of us who have some capacity to try to stay on top of the shifts and the changes, trying to give best practices when you are going to use them, creating trainings and opportunities that are free or very low cost so that people can access them easily and understand. Because the reality is this is going to be part of moving forward. It is. And so how we can in the field help people stay abreast of the best ways to use it in the least harmful ways, I think is going to be key. And I also don't want the data center in Greeley. So I will say both of those things at the same time are true for me.
Thank you. I'm reminded in this conversation 30 years ago with the Human Genome Project at the National Institutes of Health, launching this huge initiative, reminding me of many ways of a movement of the promise with little emphasis on the pitfalls of genomic kinds of research that provided all types of alleged benefits to humankind. And I get a little bit of a sense of the similar kind of messianic approach to AI and ML in this particular context. Casey, your views on artificial intelligence and machine learning and some of those promises and pitfalls.
Yeah, I would echo some of what Andrea said about I as a collective action organization. We work with a lot of community-based organizations. And part of my role and my colleagues' role is to provide some capacity building support. And oftentimes they're looking at AI as like, can it write a survey for me? Can it do these things for me? And I caution there because there are talent to writing questions that elicit the right information, right? There is like ways to script a survey that gets to the point and gets valid data. And if you don't come from a research or evaluation background, you might not recognize some of the challenges or some of the errors that it's producing. And so AI is just really a reflection of you as an individual. It's a tool. And so if you're coming in thinking it knows more than you, that's where I'm like, wait, hold on, it doesn't. And so what we have been doing is trying to educate our community about like And community in this case, right? Community being our community-based organizations, those staff members and agencies that we're working with, on how to recognize a good question, how to script those questions. So if they need some sort of assistance, they can also help identify what are good questions, what aren't. The other thing I'll say here is that the mass use AIs are language models. They are not data analysis models. And so understanding the limitations of the actual tech behind it is really important. If you're trying to have it calculate a bunch of things, you can go try to get it to tell time. It won't be able to. And I think that that's really understanding when it's moving so quick, staying abreast of what can it actually do and what it's not actually built to do, helps make those decisions a little clearer.
Oh,
Echo the
wonderful.
water thing. Also, Colorado doesn't have water, and bringing a data center here just feels like just terrifying.
Wonderful observations all. Enrique, you introduced the importance and the underappreciation of the challenges as well as value of looking at data in rural context. And I wonder if the three of you could begin to address some of the challenges as well as the limitations that unfold if one fails to appreciate the differences in place and residence in these kinds of things. So, since you introduced the topic so pointedly, Enrique, could you launch that portion of the discussion for us?
Yeah, I would love to. For rural communities, I think there's two challenges. First, our areas typically receive less research attention than urban centers. And then the second part is immigrant communities are often undercounted or entirely missing from data sets. So this means that many statistics simply do not reflect what is actually happening in rural places, especially like where I live in Southwest Colorado. So to address this, like I mentioned earlier, we rely heavily on community-based data collection, which is super important to us because that also builds community relationship, by the way, which is essential for our work. And so we made sure that when we gather this type of information from our community members, that we're making sure they feel that they're part of the research too. And part of that is making sure that those barriers to access are also addressed. So childcare, if we're doing a community conversation, food, things like that, stipending our community members because a 90-minute conversation that they could be taken off of their second shift to get to where they need to get to. So we have to make sure we're also taking care of them. But one thing I also want to acknowledge is that in these areas, like I mentioned earlier, usually when people come into research in our area, and I think of Fort Lewis College, I think of the reservations from around us. Again, people come from a lot of universities centered in metro areas. They do their research and then they leave. Fort Lewis College always is contracting people from University of Colorado to come down here and also help with research instead of going into the actually community and looking for researchers. I think of where we are situated, we should be working closer with like the University of New Mexico, who is an indigenous serving school, not officially, but they more than UC Boulder. And so I also think about how we're going into these communities, how we're getting this data, and how we're trying to protect it. The pandemic was a great example where we had little to no information about the economic impact until Region 9 put out that data 2 years later. We also didn't know the impact of COVID on our immigrant community until we were able to compile that information by ourselves. So another challenge, I guess I could add a third, is a lot of times we're doing this work in isolation and without enough support too. And that could lead to mistakes if we don't have the right people helping us do this too. We're not data researchers at Compañeros, so we do rely on a lot of collaboration with other universities and colleges. But again, in rural areas, there's a huge challenge because most of our community members are undocumented and also don't want their information published anywhere. So in rural areas, there's a few challenges, there's gaps that we see and that we have to kind of take on to make sure that data is being collected somewhere.
Thank you. Andrea.
Um, I'm so glad that you started with Enrique. I live in the city. I am an urban kid. I grew up here. And most of the organizations that I've worked with are centered in this, near the city. Although I've worked with some statewide organizations. I was with the Museum of Nature and Science for a decade, and we're a statewide organization. But you look at who and how we serve, and it is the Metro Denver region, maybe sprawling to the Front Range, and that's about the extent of it. And I think for me it becomes, and since leaving the museum I've worked with other organizations in more rural settings, but I think for me, and the only sort of like technical advice I can give is I really have become a listener. I do not know and understand the rural experience. I do not. I have learned a lot from communities that have invited me in. And I really go as technical support. Like I go so that I can help with what Casey was talking about. I can help them write the right questions to get information that really helps them make decisions. I can help them utilize larger data sets and figure out what information might be applicable and where to sort of let things go, because they're not going to be able to like do, they serve 4 counties and they're sort of in this corner of Northwest Colorado. They're not going to have the resources to go out and talk to a whole lot of members of that geographic community. I love how you helped me reframe that, Enrique. And so for me, it really becomes about, I'm really in those spaces to rely and offer support on my technical experience and technical expertise. They are there to help me understand the contextual pieces. And then we problem solve around the specific contextual pieces that rural communities face.
Casey, your views on this?
I think there's been so many great points. I don't want to be repetitive. What I'll bring up here is the power of story as data. I think that there's a lot of issues with statistical, like we need the statistical representation, and oftentimes the reason why data is missing or data there are gaps is because it's been disguised because it's not statistically accurate, because there just isn't a large enough population to get a representative sample without you know um blowing up someone's spot, making them known, and so I think that story is really an undervalued data source for rural communities. And the other thing here is I would flip this conversation a little bit to say there's so much inaccessible data stored by great land grant universities and governments, and everyone is frustrated at how we can't get that data out. And I would say the same is for rural communities. They have such rich, thoughts and ideas and documentation through oral histories. And just because it's hard for us in the city to like see that data doesn't mean it doesn't exist. And so I think that I would flip it and look at that urban rural dichotomy and understand that there's two sides of the coin. And then just uplifting what Enrique said about there are people out there that could be your enumerators that should be rooted in community to do those surveys. Like you don't need to come out and be the one doing the survey, like hire the people in community to do it.
Well, you underscored 2 things that really have struck me. One is this dichotomy of urban and rural, when in fact, what we've done is uh, characterize it as categorical either or, and that there's a spectrum and a range. Among my people, we talk about circular migration between our rural reservation homelands and the urban setting and back and forth. And those kinds of migratory patterns and movement of our people are deeply associated with certain kinds of economic, social, and other types of educational opportunities. And unless you understand the dynamic nature of this urban-rural migration, you've lost a major piece. That's really important. Enrique, I see you clapping and gesturing. Do you have some additional thoughts to share along this line?
I just want to uplift what Andrea and Casey both said. Andrea, with the technical support, like, yes, we need that in these areas. And so, like, for people to come down and offer that technical support, like, thank you for saying that. Like, yes, yes, yes. And then Casey just flipping that saying, we need to see the richness of the data that is in rural areas and how do we actually access it. And my invitation to all of y'all is I'm happy to share data with y'all. Obviously, we have to sign proper paperwork, but there is a lot of stuff down here in Southwest Colorado. Fort Lewis does a really good job with this historical aspects of the Ute tribes down here. So yeah, there's a lot of great data here. We just have to find avenues to get it out to the state or even out to the country. So yeah, I love what they said.
And Casey, your point about flipping this, and I'm reminded in the context of our work in terms of diabetes prevention and treatment, that the extension services at land-grant colleges are few investigative teams ever thought about the richness, the opportunities, the value of working closely with the extension services out of those land-grant universities. I've also been struck in our work on positive youth development how much information, both qualitative and quantitative, resides within the Forest Service and their particular activities, data sources, and areas of potential contribution that many investigators, because of their own narrow perspectives about where data resides and it may be available, that has blinded them and made them more myopic. So before we turn and open it up this broadly, I have one last question, not a question, but a request of each of you in turn. I know that each of you have had multiple success stories. I would like it success in regards to not only the conduct of the research, the acquisition and interpretation of data, but its translation and application into real world benefits for your constituents. Could each of you just provide what you think is one of the great examples of that impact that you and your colleagues have had that you're quite proud of and you believe it represents the kind of benefit that should subsequently be accrued from this kind of work? So, Andrea, if you begin for us, that would be great.
Sure. The first one that came to mind was working in a mountain town, which is also a very unique combination, and unique to sort of probably the Mountain West, anybody who has a ski resort. And it was a coalition for health and human services. And so that was a group of HHS providers coming together and really trying to understand their community, which spread a lot, from this sort of like ski town, very tourist oriented, a lot of homeowners where it was their second or third home. I mean, just really complex issues that are different, similar but different to the city. And when I initially was brought in, there was a survey they had just been repeating year after year for a funder, and they just wanted support in getting this survey out. And as we sat together as a committee and really looked at what they really were facing and where they were really hoping to go and how they hoped to serve the diversity of this very large geographic region that they were representing, it really actually turned the whole thing on its head. And we spent actually 18 months of making sure that as many community organizations as possible could be represented, which meant we had to sort of shift the dynamic of how the meetings happened. We had to provide funding for transportation. We had to hold the meetings in different places, not always in the most sort of like, populated area, which was the ski town. We really had to move it around and provide digital options. We had to hold it at different times of day. We had to provide childcare vouchers. We needed to provide food, like really understanding how we could create a true council that represented as many organizations throughout the region. And then from there, we did a lot of training and support on how do people go out and collect the stories and information that will help this coalition make really informed decisions. And so what it did was, from the survey that told them, like, here are the top 3 things that are really important to our community, which you can probably name. It was like mental health, childcare, and I can't remember the third, housing. Yeah, of course. But when we were able to go out and have community members interviewing community members, there was so much nuance within that. Sometimes organizations interviewing even their own staff about what some of these things meant, really understanding when people said like transportation within, the city limits was really different from transportation when you were living more rurally. And so it just created not only more information, but switched the priorities or gave a nuance to the priorities, but also created connections, and I think that's the heart when we talk about people's data, is it's helping us when we really frame it like that and we really hold the human at the center and the stories and the way that we can understand all of the ways that we're navigating this complex world. You carry that with you when you make decisions. And so these one-on-one conversations allowed each member of this community to be carrying the stories and the lived experiences of 25 community members that they had talked to. And so when you multiply that by the 20 people in the room, we really were starting to create a much more informed and impactful and compassionate way of making decisions. Took a lot more time, cost a bit more money, but it was they wrote to me a few weeks ago. It was still totally worth it.
Thank you. It reminds me of someone telling me a few years ago, let's not sacrifice um, these kinds of opportunities on the altar of expediency and efficiency. And, I think your example right there is so telling. Casey.
Yeah, I want to share a little bit about for Provecho Collective, we manage some state funds that go to food pantries to purchase local fresh food. And so we manage the grant program and have for about 5 years. And one of the requirements originally was for us to create a survey for the food pantries to administer to their neighbors and clients. And that was a requirement from the state level to be able to administer these funds. Over the years, we working with these food pantries, both within this program and beyond, there's a shift towards more people, more food pantries collecting feedback, collecting surveys, collecting narratives from their clients, and then using that to shift the model of their food pantry. Bringing in more fresh food, getting culturally significant items that better reflect the community they serve. Instead of doing a pre-packed box, allowing people to shop and choose what they want from the food pantry. And so there's been shifts away from this almost charitable model that characterizes these folks as like needy and shifting more towards hunger relief models that center communities as experts. Where the policy shift comes in is because we've been collecting these surveys for so long and then collecting data from the actual grant reporting process, we were able to turn around to the state this year and say, hey, look, 86% of the pantries we fund are already doing a survey in their community. We are duplicating efforts. We are creating survey fatigue by requiring yet another survey for these food pantries. And through that example, we were able to drop that from our contract with the state this year to say, no, we know they're doing this work. We know we got this. We can demonstrate what they're learning, and we don't need yet another survey to create survey fatigue. And so a very small win for us, but it actually took probably about 5 years of data collection and evidence and practice shifting to get there.
Casey, that win doesn't sound so small to me, having worked with state and federal bureaucracies and government before. Enrique, you're an example you can share with the audience.
Yeah, I touched on it earlier, and it was this executive summary that we worked on and actually are still continuing to work on when it comes to immigration enforcement in our area. But one thing that we feel it has allowed is before I mentioned like rural areas being invisible, this made us visible in what's happening in our area. Because for a long time, and especially when this administration was first in office, we've always had a lot of ICE activity, but no one has known that. And so once we started collecting the data and talking to our members about what their experience are, it was important because what we noticed is as we collected these stories, as we collected this data, we started learning about other sectors of our community that were being impacted. Kids not going to school, a decrease in folks going to work, a strain on our limited resources in this area when it comes to housing and food. And that was important for us to collect. Why? Because it shifted the conversation in our area about how we interact with the immigrant our immigrant community members here. It also helped us enact certain laws that allow us to now protect our members more, especially at a state level. The work we did that here down here was instrumental in getting the law enacted where ICE can't be at the courthouses or make arrests at or going to and from the courthouse. It helped us also get a legal defense fund started across the state because we know in rural areas there are no immigration lawyers. That executive summary also allowed us to go forward and us shift how we do our work here and get accredited by the Department of Justice for a legal assistance program that we have now. Because one of the things we saw in those surveys and those community conversations is we want legal support so we can find an avenue to get some sort of status. It also changed how people organize in our area. When we released that initial executive summary, two things came out of that compañeros had nothing to do but supported and think it's really beautiful. One was a group of citizens came together and started a deflock group like they're doing in Denver, but here. And we have had significant changes now happening where city council is looking into on how those flock cameras are being used, not only to protect our community members, but also how they're being used against our community members and our volunteers who are on the Rapid Response Network. Another group came out of that, which was No Mask Police Durango, which are trying to pass an ordinance where no masks are allowed within the city of Durango. I would like to say that this was because of the data and the stories that we put out there with this executive summary. And finally, just one last thing, the school has also adapted better to support our immigrant families, which I think is super important. Our kids are not showing up to school. The numbers show it. We have a 36% reduction in our after school programs. So when the kids don't show up to school, the school district has adapted to make sure those are excused absences. So these kids aren't affected in their education. Those are some of the wins we've had just because we've collected this data and have been able to show our community what is actually happening with immigration. And we've also been able to show the state what is happening in Southwest Colorado.
Well, thank you all for three very powerful sets of examples of the impact and benefit that can follow from this work. In the last 5 to 10 minutes left to us, let's open it up to the general audience. If you have a question you'd like to pose to the panel, please put it in the chat or just simply unmute yourself. I think Anne and Ben is another option, correct? Yeah, I'm seeing nods. So please. And I can't believe that this is a shy and retiring audience.
Well, maybe in the interim, I have a quick question for the group. A little practical advice. I think a lot of us, in the data and evaluation space, kind of our first instinct for democratizing data and making it accessible is by creating some kind of digital tool, a dashboard or a storyboard. And I'm thinking more and more about the dissemination and usability of those tools. And I'm just not sure that the folks we think are using them are actually using them. And so for those of us who create a lot of dashboards and other similar tools, what advice would you have for making sure that these really are relevant and accessible tools when we go to democratize data?
Panelists, please feel free to respond. I see Casey raising your hand.
Yeah, we maintain at Provecho, we maintain a dashboard, and I actually have gotten a lot of feedback about the usability of it. And so it's gone through some design changes to ensure that like the menu options and where filters are make sense and all of that. But most recently, what we did is we posted a video tutorial of how to walk through the dashboard. And that had been a request, an outstanding request for a couple months, and it took some time to figure out and get it to the right point, but we did that, and tips and tools on how to do that, webinars on how to walk through the dashboard. Nourish Colorado just released a flow of food dashboard, and they've had 2 different webinars teaching people how to operate it. So I would like 100% say, do not assume people know how to use it. Do what you can to support education of using the specific tool. And then no matter what, you're going to run into the challenges in rural Colorado is, bandwidth just isn't there. And so having an option that is a static PDF that can load easy, even if you spent a lot of energy getting the filters right on your dashboard, is always a good idea.
Enrique, I saw you gesture.
I was just going to add that, it doesn't work where I live. We've had certain health dashboards and stuff like that. And I don't know why. It's just not something that feels very accessible to our community. They prefer kind of that in-person, one-on-one assistance, which honestly I love because they bring me treats, so I'm all okay by it. But yeah, the dashboard has been very difficult for our community members to get a grasp of. We don't have one, like I mentioned, the health one. Also, language access. People still forget that English and Spanish aren't the only language spoken in Colorado. So making sure it's accessible to many other languages. We have a significant Nepali community in the mountain towns across Colorado, and they tend to get forgotten about. So I would say dashboards are very hard in our communities, but also the language access is something that gets forgotten about.
I just really quick from also like the ones who are doing the dashboards, oftentimes it seems like I think it's been a very popular, this is a way to make data really accessible and really easy to use and access. And when I work with organizations who are the ones providing the dashboard, it is incredibly labor intensive and it is really difficult to maintain. And so it kind of to me, they become these like rundown car websites, where it's like they kind of function, but they quickly are outdated. So I'm with Enrique. I'm just like so old school. I'm like, sometimes our simplest solutions are still the best. So that's only my view.
We only have like 3 minutes, Dr. Manson, so I was going to suggest one extra question that came from the chat. I don't want people to feel discouraged, though, so you're welcome to email our panelists, and we can share this information with our panelists too. We do have a question from Lena about how do you collect data around stories and experiences and ensure it's not going to be utilized or accessed to harm those communities in this political environment? I know that's a loaded question too.
I can start by answering this. So right now, as we're revisiting it's called States of Incarceration. It's a traveling information art piece that talks about 6 different regions across the country and experiences with incarceration and the history of incarceration. As we're now on the 10-year anniversary of it, we're going back and adding certain other stories, and we're coming across this. How do we protect people right now and protect this information without causing harm? We know there's a lot of stigma with incarceration, especially people who have come in contact with incarceration. I say that like that because we should not be using felon, as we talked about earlier. Language matters. And we want to protect those folks, especially those who are in detention, who are in contact with detention. Those names don't want to be out there. So how do we tell those stories and how do we use it so the other side doesn't weaponize it is a great question. And this is where I believe narrative is important and the data backs the narrative. And that narrative has to be checked and checked and checked in with the person telling the story too constantly. Once that story's out, it's out. And as I think Casey mentioned, if that story's out and the person says, this doesn't feel good, this feels like I'm not safe anymore, then you pull it. That's how we feel it should work. It's very simple. It's very black and white for us. Like when the storyteller says this is enough, it doesn't feel good anymore, then we stop. But how do we stop it from being weaponized is very difficult because again, depending on the research or the stories we're telling, things can be very easily weaponized. Someone doing 15 years in prison and doing 4 years in solitary confinement and then coming out and telling their story, people are going to focus on the mistake they made as opposed to how they were able to come out of that and better themselves. So it's very hard. And it is a loaded question, but that's kind of some of the things we're trying to do and answer.
Spiro, you're muted is probably going to be in Webster's next version of the dictionary for all of us. We're at the top of the hour. Thank you so much for the attendance and your careful attention to this discussion today. It's remarkable. We had 84 participants. We began with 88, and it really is a measure of the extent to which this captures the interest of all of us. So thank you very much. Anne, I don't know if you have any closing comments you want to.
I do. Number one, thank you, Dr. Manson, and thank you to our panel, Enrique, Andrea, as well as Casey, for being here and putting on such an amazing, very inspiring and thoughtful discussion. I also want to thank everyone who's here. As Dr. Manson noted, we've kept up the attendance pretty well throughout the entire session, which is fantastic. So this particular recording will in fact be available on Sketch in about a week. So we have recorded it so people can go back and listen to it. You'll also receive an evaluation on Friday about the different sessions that you've attended. Please fill that out. It does help us in preparing for next year. And then we invite you to take a small break in between our next session, which is a skill building session titled Accessing and Developing Transparent Data Resources. That will begin at 10:15. And so enjoy your break, and I look forward to seeing you all in just a few minutes. Thank you.
Bye.
Bye.